I'm nowhere near good. You know why? Because I'm an intern. And interns suck by nature.
That's the great thing about having a name like Jim Bob. People just don't expect much.
There are 721 doctors in training at Vanderbilt University Medical Center. For them, life is residency.
I've seen what these stimulators can do for folks with Parkinson's, and it can give them their lives back.
You're gonna feel some rattling in your head.
In medicine, we take our work seriously, but not ourselves.
Man, it was...
Yeah, I was ranked #1 in my class, but unfortunately, my year there was only one of us.
Yeah, there was 2 in my class, but one of them was a chimp. And that guy could read like nobody's business. Am I awake? What time is it? When I get through this day, can someone tell me how? And how much longer now am I awake? We don't rest until each and every patient is taken care of. And we're not going to rest until each and every patient is out of the hospital. Now let's go get a bite to eat. There he is. This cat right here is Jim Bob Falk, resident, hero, 4th year, mentor.
Yeah, getting a little deep in here. I've got to go do some work. What about the sign of the time of Kenaramus? We've been trying to come up with phrases that sound complex but mean nothing. Yo, is this sign of the time of the Kenaramus?
How much soporific is he on? What I mean is, how much medicine is he getting to help him sleep? Jim Bob and I try to use these words, hoping that either they won't catch it or they'll catch it and go, oh, what is that? This patient may need a bonectomy. I'll have to speak to the orthopedic surgeonizers.
The bad part is they just started their shift.
But although we may be humorous on the outside, when it's time to be serious, you know, we're serious.
What's with the self-inflicted stab wounds lately? To neck and leg.
My job on trauma is I'm the 4th year trauma chief, and I'm kind of the overseer of everything that goes on the day-to-day of trauma.
As far as I'm concerned, you know, he's kind of my boss. If he was a general and I'd be the lieutenant, and I kind of tried to learn along the way.
Just after midnight, a man is rushed to the trauma center after stabbing himself with a hunting knife.
He's real combative. He bought himself a tube. You got a story for us?
Sure, 19-year-old Brett has a history of chemical dependency. Awoke his parents.
Brett Harbison is hallucinating on psychedelic mushrooms.
They find a hunting knife in the backyard.
What was a hunting knife?
1, 2, 3.
When he came in, he had a lot of drugs on board. He was saying that he was God and, you know, asking everyone to pray to him, not pray for him, but pray to him.
Can you move your feet for me, sir? Pray to Mr. God.
What do you think is God?
I don't say I'm God, I know I'm God.
When people come in and they're out of their minds on drugs or alcohol or whatever, that kind of stuff bothers me because you don't know really what's going to happen. I mean, those are the kind of guys that can at any moment jump up and like do one of those Sylvester Stallone kind of deals and just break your neck.
We need 100 lidocaine.
It scares you.
Is he talking to you up there? My job as the trauma chief, when everybody's heart's beating 120 beats a minute, I want them to look back there and see me standing at the foot of the bed and feel like there's somebody back there who doesn't look like they're nervous as can be.
No, we're not praying in my ear. Pray to Mr. God.
Thought he was God, and God decided to plunge a hunting knife into his leg and then through his neck, kind of right above where his voice box would be. Our definition of maintaining your airway is having a normal voice, talking and conversing.
You're not praying for that.
And he was talking and conversing.
Where's the blood coming from that's in his mirrors?
But he had blood in his nose. And so you've got to wonder, where did the blood in the nose come from?
Did you fall or hit your nose?
Hit my nose.
There's a lot of dry blood in your nose.
For Jim Bob, the blood in Brett's nose signals an injury to his throat.
Open up, stay off. Are you praying for that? Pray.
So the problem I have with this guy is that he's so nutty, I'm not going to be able to trust any type of exam on him.
Exactly.
Oftentimes we don't operate on these neck stab wounds, but in a guy who thinks he's God and obviously doesn't cooperate with any continued physical exam, we thought he definitely needed to go to the operating room and be explored.
Lay back, Brett. Lay back. Lay back. There you go.
You know, I was off yesterday and I just had the best day. I worked out. I never work out. I hate working out.
Push, 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 push.
And he's out. I'm a first-year resident, which means I'm an intern. An OB-GYN intern, that's what I will be doing. Come on, honey. You're doing good. Delivering a baby is a lot of fun, but it's actually, I'm so nervous that I just forget to think sometimes. I'm a terrible driver. I'll be careful there, okay? I learn every day. And this place is you see so much stuff. This is Miss Laura. She's 11 weeks pregnant with some vomiting and fever. Hello. Hello. Hi. Hi. How are you?
Fine. I'm fine.
Good. Okay, you're 11 weeks pregnant?
20-year-old Miriam Larar has lost 10 pounds in the first trimester of her pregnancy.
I haven't eaten nothing for the last 3 weeks.
She can't keep no fluids down, just comes right back up. Just lost the weight.
Okay. Vomiting. Pregnancy is a really awful thing. All the new hormones that the placenta is making makes mom not feel good. And everything makes them nauseated and they really can't eat, and that can be very devastating. She can't be losing 10 pounds. She needs to be gaining weight.
She's been vomiting the whole time, but like these last 3 days, real bad.
Really bad.
Bad.
A lot of these women that come in, they're teenagers. They don't know what's going on. Any back pain?
Yeah.
Mucho.
I think about how I was when I was a teenager and I had no idea what was going on. If I had a baby, oh my Lord. All right, you don't want to freak them out. And we'll give you some fluids in your vein and nausea medicine.
We'll put an IV in.
Rachel hopes an anti-nausea medication will help keep Miriam's food down.
Pregnant women can sometimes need to be hospitalized and rehydrated and started on a number of medications to get them to stop vomiting and kind of stabilize them. I wouldn't be surprised if she is admitted because she's lost 10 pounds. Where's it hurting? Right here? You can't be losing weight with the baby. You have to be gaining weight.
The brain is the most magnificent organ in the body. It defines who we are. Without it, you're nothing. Well, Chuck Stevenson right now is still at the bottom of the totem pole. And he has several years to go before he gets near the top of his dental fine. I had a lot of people tell me, listen, if you're thinking about neurosurgery, it's a hard life. The residency's 7 years, and that's 7 years of your life that you won't get back, and you'll be at the hospital all the time. It's really a sacrifice. Hey, Barry, it's Chuck.
Chuck Stevenson is part of a neurosurgery team using experimental treatments on patients with Parkinson's.
Morning, sweetheart. Are you nervous?
I'm not nervous.
You're not nervous? We're gonna walk you through it every step of the way, okay?
In the past 6 months, Barbara Lilly's Parkinson's has spiraled out of control.
Right. It's gonna be a long day for everybody, but hopefully we're gonna do something really good here. That's right.
On the side or not?
You always root for your patients, and particularly ones that suffer from a disease like Parkinson's, where their life has been taken away from them, and they're aware of it. It would almost be more of a blessing if they weren't aware, but they know it. Imagine that.
Barbara and her husband have agreed to have electrodes implanted in her brain. It's an operation known as deep brain stimulation.
I've seen what these stimulators can do for folks with Parkinson's, and it can just have tremendous effects and give them their lives back. We wouldn't expose them to such a potentially hazardous surgery if we didn't think we could do something truly special for them. We want to make sure that we get the maximum benefit, or else this isn't, it's all for naught.
All right, back away there, Shipman. You dog.
I win. You get the leg.
Yeah.
I was gonna get the leg anyway, man.
Told Phil you were here and he said he'd take his time. I didn't tell him Shipman was here. He probably would have come faster.
Oh, that's true. Pick out a dream.
Thinking he was God, Brett stabbed himself in the leg and neck.
Thanks, sir.
Can we get a gram of Ansef?
He had stabbed himself in the neck. And, you know, you got major things right in here. This is not a free area, you know. So we took him to the OR just to do an exploration of this.
Let's see where that puppy goes.
That's a pretty upper level kind of a case. And so for me to be in the OR was really pretty nice.
Shipman was in there, and he got to see the hypopharyngeal injury, and it's all about seeing more than anything else.
Incision.
He may never see one for the rest of his residency, so it was important for him to be in there.
Feel that.
The hole in Brett's neck leads all the way to his Adam's apple.
It's thyroid cartilage.
Probably 70% of the time, these stab wounds to the neck, nothing major is injured. But with this one, just the extent of it, he definitely needed to go to the operating room and be explored.
It should be coming up on that jug. If I could just see that, at least I'd have my landmarks. Oh, man. Nearly transected this sucker. Here's TJ. Sucks all the way down in there.
You know, when you heard about slitting someone's throat, that's essentially what he had done. If you were to cut halfway through a hose and then bend it, that's kind of what it was.
Okay, hemostat, please. The amount of bleeding that's coming out of this thing. Did himself a job, didn't he? Man, that's a good shot. Well, he did himself a lot more severely than I would have thought.
Me too.
I'm really surprised he didn't come in respiratory distress.
Once inside Brett's neck, Jim Bob shows Jason how to repair the injury.
Cheated up and curved it.
Sure enough, the knife had made it into his actual throat, you know, where food would pass down from your mouth into your esophagus, and almost cut it in half.
Yeah, he did himself pretty good.
Did himself a job, didn't he?
Can you see this? So your stab wound was here, and your track went just anterior to it like that. It means he's had a penetrating wound.
Okay,
One stitch?
One more stitch.
It's a good sized hole.
Lucky guy. Man, I mean, you could have easily lost your life.
Hemostat?
It was an interesting injury because it's just not all that common.
Whew, that was a great case. That's important to get in on, even if you don't do a lot. It's a good idea to get involved early on as a junior.
It's been real and it's been fun. It just hadn't been real fun. Another life saved.
Paperwork. Never done.
And this is when I need to be at the top of my game in decision-making capabilities.
Yep, that paperwork's tough. Hate paperwork. It's a tough job for all us residents.
I'll just supervise.
Now we need to get her hooked up with some IV and give her some relaxing medicine.
Yeah, she's in pretty much pain.
Yeah, I know, because she had no meds since last night at what time? 9 o'clock. That's perfect. She's miserable right now, and that's fairly obvious just by looking at the expression on her face. When we get in the operating room, we're going to rely on her symptoms to help tell us where we need to be and when we're helping her. It's a very fun surgery to do, but it takes all day, and it's a bit of a marathon, really. So you have to eat. I mean, especially for this, doing this bilateral DBS procedure, you know, I may not see food again till tonight at 7 o'clock, and I don't know, I will have a splitting headache if I go 12 hours without anything now, so I gotta load up while I can. These are the donuts. I should not be eating any of these, but I think I'll treat myself since I was on call last night. You get hungry, and even when you're not hungry, you eat for comfort.
Hey Chuck, how much did you weigh before residency?
I can't recall, really.
And how much do you weigh now?
About the same. We do joke around a lot, between all the residents and between the attendings. In the clinic, they call me Sugar Britches.
Chuck's new nickname is Sugar Britches Jr.
Yeah, heard about that.
Sugar Britches Jr. And it's because their butt gets a little flabby and does the wiggle thing, so we just decided Sugar Britches one day.
I hope that doesn't stick. Yes, that's another chocolate donut. I'm a creature of habit.
He's Chuckles.
Sugar Britches.
Sugar Britches.
I don't respond to any of those names. I'm going on a starvation diet. Oh, yeah.
For internship. This is a little mini ultrasound so we can see the baby.
Miriam is 11 weeks pregnant and has been losing weight instead of gaining it.
So mira que todo está bien.
She said, can you tell, like, from looking at that, if the baby's okay?
You can see him moving around. I'll show you. Let me get you a good picture. There's heart right there.
No sé.
I can't tell if it's a niño or niña. No, once they saw the baby, they were just so happy. And that was just the coolest. But while I'm monitoring the fetus, I'm totally methodical in what I need to do. She's got a viable fetus that was moving and had a heartbeat, so. You just make the decision, is this person sick enough to stay or is this person sick enough to go? And she was, for a long while, giving me the impression that she was sick enough to stay. How are you feeling? Better? Smells good in here. If you can finish that and keep that down, y'all can go home. Her family had bought her a cheeseburger and fries. She's sitting there eating a cheeseburger, and I was like, okay, you can go home. We'll give you that medicine we gave you through the IV, we'll give it to you to take by mouth.
Oh, okay.
Okay? I mean, you're already eating, so I would hope that if you take it regularly, you can take it scheduled 3 times a day, it should cover you to be able to eat. And right when you wake up, eat some crackers, eat something, get something in your stomach right away. And keep hydrated, okay? So I'll be back to check on you a little later.
Okay.
Miss Laura is doing well now. She is eating a cheeseburger, and so I think that's doing well. Since the Zofran worked well for her, we'll go ahead and give her Zofran to go home on, so we're all set. All right, well, you take care, okay?
Thank you.
Y'all take care. I feel good. I was worried about her when she first came in, but she's doing okay. I think she'll make it. If she can eat a cheeseburger, she'll be all right.
What side's the worst, your left or your right?
Oh.
Your left.
Dr. Conrad is the chief attending that I'm working with right now. And all the while, I'm sort of right there attached to his hip.
They're going to want to hook up those electrodes here.
You know, he feels responsible in some way for training me.
I'm not here to make friends with the residents. I'm here to engage them in the bargain we made from day one. And we teach them things that in the end, they're going to be as good as they're going to get. Dr. Stevenson still hasn't seen the whole gamut of tricks of the trade per se, but as the maturity level of the residents goes on, they're actually asking more questions.
How do we know there's nothing here?
And that's what makes a good surgeon. Okay, here we are.
Dr. Conrad specializes in sort of a very new, evolving field of neurosurgery. It's functional neurosurgery, stimulating the brain. And this is somewhat new. It's cutting edge.
Can you do this for me? How about with your hand like this? This is Parkinson's disease. This is what Parkinson's is about. It's not the shaking, it's the rigidity. The fact that they have a cramp that basically captures their entire body. Alrighty. Promise you one thing, we're going to try and make you as comfortable as we can here, okay?
Gonna feel a little pressure.
It's just pushing on your head right now.
Get this to lock in place. With deep brain stimulation, there's a particular area in the brain that when stimulated results in alleviation of some of the rigidity that these Parkinson's patients experience. All right, Barbara, you're gonna feel some rattling in your head, okay? It's gonna last just about a minute. Just gaining the exposure for the whole setup. For the first part of the operation, it is basically me. I get to do all the technical aspects of passing the electrodes to the brain.
All right, so keep widening it up.
Dr. Conrad keeps a close eye on Chuck's work.
That's the ultimate on-the-job training. I get nervous, obviously, because I'm still very early on in my training. But you learn how to do it by actually getting in there, making that incision, drilling down, and seeing it all for yourself, which is a risky business. And at any point, they could potentially have a bleed.
Doing okay, honey?
There you go.
Favorite organ? That's an interesting question. Actually, it's not really an interesting question. I mean, that doesn't come up at parties very often. The nose is pretty interesting because people have all kinds of mysterious beliefs about what goes on beyond the shadows of the nose. And it's kind of neat to know what's really in there. It's cheese, actually.
That's the normal world here, and here's the world of deep brain stimulation.
You're gonna burn one side into the other.
Yeah, that's fine. These are the towers along with the electric drives that we'll use to actually pass the recording electrodes as well as a stimulator.
Tiny electrodes will be inserted into Barbara's brain to help ease her Parkinson's symptoms. This procedure could help 100,000 people in America alone.
Instead of cutting things out of the brain, we're sticking things in the brain to change the way that it works at some level.
That's the final target. That's how deep down they are in the brain.
The stimulators will follow a path based on a computer model designed by Dr. Conrad.
The process of putting that electrode into a target the size of a pea is the equivalent of throwing darts, neurosurgical marksmanship. We can't afford to put an implant on the 10 ring. It has to be on the bullseye. We have to be right where that infrared dot is at, basically.
I'm ready. Here we go. Yep. Okay.
And this is where the fun starts. We'll make a pass down to the target and listen along the way.
Okay, Barbara, just relax.
Okay, you have a 14 hertz for the first channel. Second one about 15 hertz. Okay, next one will be 1.5.
He's moving that electrode down a half a millimeter at a time. And we're listening now for activity in those nerve cells.
This is 0.5 volts.
Okay, so you're going to tell me if you feel anything, right?
But these are incredible cases. This is the fourth one I've assisted on, and not every resident at every training program gets the privilege of doing this sort of groundbreaking surgery.
1.5.
The target's defined by her loosening up today. That's the bullseye we're looking for. When we're in the target, her stiff arm ought to release out so that it's as loose as yours and mine. Oh, she's stiff.
Okay, next one -3.
Okay, tell me if you feel anything.
Still probably 5 millimeters or more above the ideal target. What depth are you at, Chris? 5?
5
Probably right about here. And we're listening to the cells as they're coming through, so this is the whole process of micromapping.
Millimeter by millimeter, the electrodes search for their target.
Try to repeat after me. Fire engine is red.
Good luck on her.
But the bullseye is hard to find.
Tell me your full name.
Well,
Problem is we're not getting the results we want, so we need to make some necessary corrections and keep going on.
we're basically going to flip the thing and we're going to make a 45-degree move. Chris, back it up to -4 again.
Sure. Next one -2.
Jim Bob is what I would think is just a natural surgeon. So.
That's right.
Can sing, can dance.
You know, bench is 350.
Emotions have been surgically removed.
Steel will.
Steel mind. Ching, ching. I don't know. You know, a surgeon has a certain bravado, a certain daring do.
If you ask any surgeon, what do they want to see? Well, they want to find a problem that they can operate on and make better. You know, you work hard, you see this patient that you barely know, who you see back in clinic that, had you not been there to intervene, would be dead.
Hey, Brett. How you doing this evening?
After a night in the ICU, Brett has finally come down from his mushroom high.
You remember me?
The next morning, he woke up and had zero recollection of any of that was a normal person.
Were you aware of any of the events surrounding whenever you stabbed yourself in the neck? Or were you pretty much out of it that night?
I was going crazy. I was out of it. My brain was thinking all kinds of weird thoughts.
Okay. Now, you've had some drug problems in the past. This is the first time something like this has happened since then?
Doing quite well, I guess. I kind of slacked off of my program.
Yeah.
Relapse.
I'm glad to see you're feeling better.
I'm glad to be feeling better.
Good.
He was just a regular old guy. I figured I'd go up there and he'd be like, bah, I'm God, you know, but he didn't. It all cleared out and he was a regular guy.
I'm telling you, man, it's very interesting to talk to you now and to compare that to when I was talking to you the other night, because you're a total different person.
I bet.
I thought you were...
As far as the drugs are concerned, he's going to need some help. But physically, physiologically, he was doing pretty well.
That's good. I know you well. I was one of the guys that helped out with your operation. In fact, I'm the guy that sewed up your leg and your neck. So if you don't like your scar, then you can come talk to me.
It was good to see him normalize and go talk to him face to face.
After I'd injured myself, pretty much after that.
Yeah. I can't say it's really funny. It's funny now to kind of look back at how you were and how you are now. But at the time, it was pretty scary. So. All right, well, I'll leave you alone. Let you watch TV or do whatever you need to do.
I'm convinced that most medical diseases are manifest from a lack of chocolate donuts in the diet.
Chocolate donut a day keeps the doctor away. It's the much less used, but still most important adage.
You know, there's not any of what you might call literature about it.
All right, let's go order some food before we go. Have this door removed immediately. And that too, have that removed.
All right. Okay, next one, -3.
Deep brain stimulation surgery is time-consuming.
Now look over that way.
But Chuck has never seen this procedure take so long.
Next one will be -1.
Look over toward Mark.
To me. Even more important than the fact that I'm tired is that we're not really giving her any efficacy, so
Yeah, this is the -1.
it's,
that one,
in a sense, just not
No, this is
working.
the next one, -2.
Yeah,
Yeah.
it's the same. Just ease up.
1, 0.
Look down to the right.
What?
Do you feel anything?
Hurting. We basically asked her to keep still for 8 hours with stiff back. She hadn't taken her meds. She was already rigid. Imagine doing that. I can't do that. But she did it. She was a trooper.
Move by 2.
From her part, she did beautifully.
Okay. What does that feel like?
You felt like your eyes got stuck?
This is a problem with doing surgery like this that is relatively new and sort of on the frontiers of what we know, because we don't fully understand everything yet. And obviously we run into some difficulties sometimes.
We're kind of teasing the area. We still can't find it.
6 hours into the surgery, the team is running low on options.
We need to learn something here about what's going on. Why is it she's so different than everybody else we've done? What evidence do we have from the equipment side that something's not working right?
No, nothing.
No. So we're going to go posterior now, and then you try your little cannula.
Okay.
So 2 millimeters on a 45-degree angle, posterior medial.
Now our target is further back on her head and then re-past the electrode. Hopefully we'll be on target.
All right. Okay, next one, -3.
Stick your tongue out. Push your tongue out. That was cheek, face, that was everything.
Barbara, can you say something?
Barbara?
No area that we stimulated caused anything like your Cinemed is, huh? Okay, I'm calling it quits here. I'm not going to leave an electrode in today, okay? Because I don't feel good that we found a good place to treat you. Do you understand what I'm saying? We just need to regroup and ask ourselves what's going on here. I don't think any of us knows here, but we've given it a long try today here, okay? You've been very cooperative. We really couldn't have done it even this far without you helping us out as much as you have. So I'll just get her comfortable so she's not hurting so much.
Okay. I just feel really bad for the patient and the patient's family, because a lot of times they'll sort of hang their hopes on this. It's sort of their last best chance for a good outcome from this disease process. And I would like to be someone who gives them that good outcome. And today I'm not. So it's very disappointing. At the end of the day, we just weren't able to do what we wanted to do. 8 hours later, really, we were right back where we started from. And that's a failure.
You're going to get your dopamine, your Sinemet here in a little bit, okay? So that'll make you feel better.
Dr. Conrad's done a lot of these surgeries, and I think that he's gotten so good at doing these surgeries now that he just somewhat expects that he's going to be able to do what he sets out to do. Yeah, it hurt him.
Nobody ever trains you how to tell people good and bad news. You just learn. Hey, Mr. Lilly.
How are you?
All right, all right. Have a seat.
Oh, I have to follow up on somebody's MRI. That's fine. It's hard sometimes because you are being pulled in 20 different directions, and you're really expected to do those 20 different things at once. It's amazing. No problem. This is Rachel Lamar. You okay? We all knew it was going to be bad, and I luckily have my boyfriend who's an intern also, so I can go home and say, oh my gosh, this happened, and he could say, oh my gosh, this happened, and we totally know the pain. It's painful. On top of everything, working all the time and never being home, I'm just, you know, Ben and I are in the midst of, I'm in the midst of waiting for a ring, so I'm getting a rash right where I need the ring to be, right there. I would like a ring, I'm waiting, but it's okay. It'll happen. I'm gonna be patient and good about it. Still, something to wear would be nice. Ben, my boyfriend, we met in medical school. I was actually dating someone else at the time. It's very bad. Hello, how are you?
I'm okay.
This is Ben.
Hello.
We decided to get married very early. Now I think we're at a point where we're okay with that. But I don't know what he's doing. I'm waiting for a ring.
The ring pressure from you, the ring pressure from...
I had ring check this morning. Ring check. I was like, I don't have one yet. Ben actually, he knows. He told me the more I pester him, he'll wait longer. So I was like, okay, I'll be quiet. He's frustrating me. But you know, it's okay because... I don't know, it's not okay.
You can feel some cool water. Just washing you off.
It's pretty disappointing. This is the first time this has happened to me on one of these cases. Very unfulfilling.
What do we have for dressing? Anything I want. That was a very long operation. Thanks. How you doing today?
I'm doing fine. How about yourself?
All right. Is it chilly out there?
No, it's actually pretty nice.
I need to get out there.
You really do?
You know, as physicians, our first principle was, above all, do no harm. And we upheld that. We didn't do her any harm. Problem is that we weren't able to help her. That's what we're in the business of, is helping people. So you feel worthless.
We saw no efficacy, and we moved all over the place. So what did we do at the surgery that resulted in the problem?
You can't just sit there and wallow around. You just have to take it in stride and regroup. And that's what Dr. Conrad actually forced me to do.
You have to have that very critical self-analysis going on all the time. All the time.
Let's go rag while we can. Go to sleep.
Man. Man, it's like thick. Something's gotta be done.
Can't breathe. Beginning to lose peripheral vision. Man, it's for the good of humanity. Can you smell that? I'm a problem solver by nature.
Am I awake? What time is it? Am I awake?
This is the worst time for
What time is it?
for a trauma. It's very bad timing.
Whenever that pager goes off, you just have a Pavlovian response to run downstairs and see if you can help. For some reason, it's not hard to wake up and know that you got to get to work. So I'm going to say that to Jan, but you know, that's what it's all about.
You don't know. We're just going to expect the worst and go from there.
"19-year-old Tom Douglas was thrown from his car in a high-speed accident.
All right, seasoned and growing up. His airway is not tightened right now.
All right, let's get him over. Let's get some IV access.
I don't necessarily look forward to people getting in car wrecks.
We got the drugs drawn.
I got him.
But I like the training that I'm getting to think that rapidly and to be able to make those quick decisions.
Need some trauma shears.
Yeah, vomited in his mouth. I mean, was it?
Yeah, nemesis all over.
That.
All right, let me take a look.
If someone was ejected, they've gone through some pretty significant force to be thrown out of a vehicle through a windshield. They could have some pretty significant injuries.
Get some IV access, we'll get his airway.
In an emergency situation, airway is a big, big deal. You just can't wait on the airway.
All right, let me take a look.
There was somebody working on airway and breathing up top. They just needed a way to get drugs in, so it's my job to get a line in, put some blood in.
Go ahead and start the fluids. There you go.
There we go.
Balloons up. They say when he went down, I mean, when he started tanking.
It sounded like he was okay and then just started getting sick.
Sometimes you're treating people that can't speak to you. They can't tell you what's wrong with them.
I got DPs bilaterally on him.
They could have some pretty significant injuries that are hidden. That's part of the learning process, is developing that skill so that you can figure out people like that.
Pupils are okay?
His pupils are 7 right, 5 left.
Douglas's eyes could indicate a serious blow to his head.
That's kind of a sign that something's wrong, and you need to kind of get to the bottom of it.
Chest x-ray, pelvis x-ray. Get him a CT scanner.
But his pupils weren't equal, so I'm gonna look at his head.
A CAT scan will focus on Douglas's head, where road rash signals an injury.
That's just a tough thing, man, being ejected. People flat out die, and that's a no-brainer, but I mean, they really need a good eye because they could have some pretty significant injuries.
So this is 1, 2, 3, 4.
I know the 5 general rules of general surgery.
Trust no one. Eat when you can. Sleep when you can. Pee when you can.
The esophagus is not your friend.
Don't mess with the pancreas.
Don't with the pancreas.
It's not like the heart. You can take the heart out of people and put it back in and it still works.
He's on the scanner right now. I'll be here all night. I'll see if I can get it in. See ya.
I mean, he's got some findings that his, something's going on with his head, so we'll see what his head scan shows. His pupils weren't equal, so we'll see.
The CAT scan shows Shipman that Douglas's head is okay. He should wake up in a few hours.
He's a tough guy, man. Got a thick noggin. Probably a hard-headed guy. You know, his pelvis may be out.
Yeah, his left hip is out.
Douglas's hip is a different story.
You want me to call ortho to have him relocate while we're here? Yeah. The ortho guys, they like to be notified so that they can come see it in the scanner.
Is this the guy that just came in?
Yeah. That way, if it needs to be relocated, they can put it back in socket while they're on the scanner and then scan through it and see what the injuries are. Where is it? Wow.
That's going to be hard. This is rare. His left hip has come out and come in front of his pelvis.
Most of the time it comes out like this. If you get hit in the leg, it pops out this way. For some reason, he had an anterior dislocation, so that was an unusual finding. That's my first one to see.
We're going to do it here?
Yeah.
Oh, yeah.
What are we doing?
Never reduced one of these, so this will be interesting.
Watch his boys there. I don't want them to get squashed.
I'm not kidding. All right. Hip dislocations can be very difficult to get back in.
Can I give some traction kind of here? Does that help?
That's a little play there. Normally, all you have to do is kind of hold on to the knee and work the ball back into the socket. But his was the other way around, so we essentially had to push it in the other way, and it was a little more challenging. You can feel it pop back in. You know how a car door sounds? If it catches, it goes boom. Kind of feels like that.
There it goes.
Yeah.
Way to go.
We were able to muscle it in, so. I won't say muscle it in, we were able to finesse it in.
Apparently, all it needs is an orthopedic surgeon on the bed torquing on him in several different directions.
I get to hog the next one.
I don't think you could do it, but you can try.
You'll need an orthopodic surgeonizer for sure.
No ring. So that when I do get it, you can just superimpose before, after. It's very naked.
Why don't you just propose to him?
No. That's what I did.
That's what you did.
You did? Apparently, my mom did propose to my dad, and like within 6 weeks, I think they were engaged. You know, it's just a sweet romance story.
And I thought he was the cutest thing I had ever seen in my entire life.
Gross.
I mean, you know, we're just turnips. You know, we were.
Got them from a catalog, yes.
Yeah.
They were very, very poor, and so her engagement ring is really small, which is cute, you know. But I told Ben he was gonna have to do better than that. We had a girl in med school. She had a huge. I mean, I don't know how she did anything with it on. It's too big. Not too small, of course. You know, at least a carat, I think, is a nice, good, you know, simple, round cut.
Yeah, we'll keep an eye on Rachel's finger because we know that they're meant for each other, so something will happen.
I think he's gonna do it when we go on vacation. We're going to Cancun. The next time you see me, whether I'm engaged or not, I will be very happy. It's okay. He has a plan, and I trust him completely.
When I saw you downstairs, you were still out of it, and then I was off the next day, so I haven't never gotten a chance to talk to you. I wanted to come by and say hi and make sure everything was okay. How's your top of your head working out? Did they work on that a little bit?
They put some cream on it, it's coming along.
You know, most of the time, especially the way that looks, that should come back without any problem at all. You shouldn't have much of a scar from that. How's your leg? How are you doing walking around?
I was on crutches earlier part of this morning. I was walking around that.
Well, good. Did you remember me talking to you over there in the unit? Because you were kind of...
The only thing I remember is out there on the side of the road, the ambulance picking me up and everything. That's the only thing I remember. I don't even remember coming up in here.
Well, you're a big guy. There had to be several people up on the CT scanner yanking on you, so I'm glad you weren't awake for that. So,
if everything goes well, you'll be out the door today.
All right, thank you.
We did the right thing for that guy. You like it when they come in the hospital and they get better quickly and go home. I mean, that's nice. So.
Man, so typical of you.
We had to talk to her husband, and obviously what we wanted to be telling the husband was, oh, it went fantastic. She really just loosened up and was very fluid and no tremor. You know, that's what we want to tell him. Hey, Mr. Lilly, it was a very disappointing day for us. We tried and tried. Dr. Conrad was pulling out every trick in the book that he knew because we wanted to get her a good result.
Yeah.
But in the end, we were just going to do her more harm than good, and so Dr. Conrad, with all of his experience, just decided better just pull out.
Back up and regroups what he told me.
Exactly. Fight a good fight another day.
Yeah.
Anyway, it was sort of humbling for all of us.
Yeah, that's what he said.
All the computers and everything that we had in there running, and we still couldn't get where we wanted to be. But anyway, there's a neurosurgeon. I wanted to help him out. Dr. Conrad wanted him to help him out. But for her and her family, it's back to square one. Yeah, there's no set time limit. We need to let her... As far as we think we've come, really, when it comes to the brain and a lot of these neurological disorders, we're still just at square one. Okay, Miss Lilly. And we have a lot of things to figure out, so we will learn from what went on today, and we will apply that to cases that come up in the future that are similar to hers. Every day you come to work, you should learn something. And I do.